My name is Temba Sherpa. I'm from Thami.
And so how did you become involved in Khunde Hospital?
This is a long story, but the hospital was built in 1966 by Sir Edmund Hillary, and from 1966 onward, the hospital has been staffed by foreign volunteer doctors. And I happened to work as a medical assistant with foreign volunteer doctors for at least about 12, 13 years, and I really enjoyed working with foreign volunteer doctors. Majority of the foreign volunteer doctors are from New Zealand, few are from Canada, and they really inspired me to do further study in medicine. And so I received a scholarship from Sir Edmund Hillary and Chico Corner, the president of Sir Edmund Hillary Foundation in Canada, to do my medicine in PG. So I was there quite a few years, and after completion of my medical degree there, and then I came back and did my internship in Kathmandu, a residency in Kathmandu, and then I came back here and started as a doctor from 2002.
Okay. And over that time, you've been involved in Khunde Hospital for a very long time. How has this hospital changed?
That has been changed a lot, and before started build this hospital, people never heard about medicines. People never heard about doctor. Never heard about the hospitals. And if someone is sick, the shaman or lamanism or the only mode of consultations there. So as a result, there were high maternal mortality, high infant mortality, and people were mortality. But over the years, there has been a remarkable changes here, and our volunteer doctors in the early days did very hard work with the local people, how to build trust towards the medicines and Western medicines and the hospital, at the same time respecting the culture and the religions there. And it has been remarkable changes there, and now all the health indicators, important health indicators, are moving towards the positive directions, and we now haven't had any maternal mortality for more than 25 years, and infant mortality, neonatal mortality, and under 5 mortality are remarkably dropped down, and we more than 95% of the pregnant ladies come here to have the babies, institutional deliveries, and vaccination uptake is excellent. More than 99.9% of the children around here are well vaccinated, and we haven't had any malnourished children for a long time, unlike other parts of Nepal. Contraception program is well used up here, and I should say is one of the most successful program of this hospital. As a result, mothers are healthy, they have more money to send their children for better educations. And so all these are a very good changes that the hospital made it here. And again, the most important is now the hospital people really trust to the health worker or the medical staff here, and people really trust now the Western medicines and hospitals.
So you've just described some incredible success, but it must have been, as you said, quite difficult to sort of introduce Western medicine in this sort of hospital set up to this region. Can you tell us a bit about the challenges of sort of the cultural integration of medicine here?
Yeah, there was a lot of cultural difficult barriers were there, and like in the old days, like people were the cultural belief is that if someone is sick, they shouldn't come out of their house. If they come out of the house, then the ghost will attack them. And so as a result, in the past, we used to have patients coming in only in the very late stage, and sometimes ended up with almost too late to treat them. And then there are other sickness, like a mental sickness, like a postpartum depression, which is common in the Western society too. But here we have got this. There are some cultural stigma associated with this postpartum depression. So if someone is sick with the postpartum depression, they shouldn't come out. They shouldn't touch with the cold metal. They shouldn't get the fresh air, and all they need is they have to eat a lot. Then they ended up with obesity, overweight, and big problem. Now these are like more or less eradicated there.
Fantastic. And I was wondering if you could just touch on, because you were saying how there's been a lot of Western doctors here at Khunde for many, many years. I think up until about, is it 2003?
2002, yeah. 2003, yeah.
Would you be able to tell us a bit about how important it is to have local doctors?
Yeah, I think that was the 38 months was goal train the local people and let the local people to run the hospital, and of course without the financial backup from the foundations or from the foreign aid, like we wouldn't be able to run this one as a private, as a pre-medical services there. We can't provide pre-medical services without the financial backup. But that was the 38 months goal, and it seems working well. And I've been working here as a medical doctor for more than 20 years now, and people trust us, and having the local Sherpa doctors is a lot easier because we speak the language, we know the culture, and we know the people.
Yeah, well, people certainly do trust you, and you have amazing facilities here, and people travel from a long way to come here to Khunde Hospital. Would you be able to talk a bit about what this hospital provides to the community?
Yeah, and we provide public health and primary care, and so in the additions, we have got 15 beds, so we can hospitalize the patients here, and we have got X-ray machines. We upgraded to digital X-ray from 2016, and that really help us to diagnose the most of the they'll help us to diagnose the problem. And we also have ultrasound machines, we have EKG machines. So most of our diagnostic equipments are improved these days.
I'm very proud of Ed for having built this hospital, but you're the one that has run it and made it a hospital for so many years. You must be very proud.
Oh, I'm very proud. I'm very proud because I got a scholarships from Saritman or Himalayan Trust in New Zealand to do my high schooling. And in those days, there was only the Khunde school was up to only grade 7, so I got a scholarship to do my high school in Lower Down, and then I got a scholarship to do my medicines there, I was very lucky, and I was very lucky to have to work with such a good institution.
Yeah. One thing that I think I just want people in New Zealand to know is how important this hospital is to the region, and I was wondering if you would have anything to say to sort of supporters in New Zealand, because obviously there's support for Khunde Hospital for 2 years, but after that we don't know. at this stage. And so obviously it's very important that this continues. Is there anything you'd like to say to our supporters and donors in New Zealand and abroad about the hospital?
Yeah, well, our catchment area is getting a bit smaller than it used to be, just because of our private hospitals and other hospitals and government clinics are growing in other parts of Khumbu. But again, Khunde is, we are right on the top of the Khumbu, and it's still about 3-4 days walk to get the road access, and the helicopter transport is very, very expensive, and if someone is very sick, it's very difficult, and so it's very, very important to continue give services for the futures.
Thank you. That's, I guess, all from me, I think. Is there anything else you would like to share or say?
Well, yeah. Yeah, right, yeah.
No?
Yeah.
Okay.
Well,
all right, well, thank you so much for your
and yeah, say something, yeah. Yeah, well, yeah, compared to these days, like, it was quite easy to practice the medicines up here, because people trust to us, people trust to the hospital, but in old days it was very, very difficult, and I really honor, I really respect our volunteer doctors in the past, how difficult and they had to work in those sort of situations there. So all the volunteer doctors who worked here, and all the members of the Himalayan Trust New Zealand, and including Sariat, and all the people who gave a hand to Sariat, are greatly appreciated by the people in these regions.